2016-17 has been another year for KB Division of continuing to strike a balance between daily clinical practice improvement projects and system-level advocacy and advancement. Let's take a tour around the division tree to see some highlights of what's been happening in Kootenay Boundary. Starting with team-based care of complex patients, our child and youth mental health and substance use team launched a family-centered wraparound model of care for a sample of children and youth with moderate to complex mental health and/or substance use issues. 49 people participated on 7 wraparound teams. 75% of youth improved on the symptoms and functioning severity scale, and the family's improvement on 2 of the family empowerment scale subscales was statistically significant. Parents said wraparound was the most effective intervention they had ever experienced for addressing their needs. Perinatal work also continued this year with a wide range of resources developed for physicians, families, and community organizations. Motherwise, pilot group sessions in Trail, Nelson, Castlegar, and Grand Forks resulted in a statistically significant decrease in EPDS scores for mothers attending the groups. And Step Into the Light events built awareness for perinatal mental health challenges in 4 communities across KB. Team-based residential care made strides this year with 8 local meetings and the first ever regional meetings. Physicians, nurses, IH administrators, and care facility managers and providers together discussed and developed solutions for improving care for KB seniors. Results achieved through this team-based, data-driven approach include 34% decrease in ED transfers since 2015-16, an 18% decrease in the number of patients on 9 or more meds, and a 12% decrease in patients on antipsychotics with no psychosis diagnosis since 2014. As part of this work, a dementia tool for practitioners and families was created. Circulated originally through KB, it has since been reprinted by many divisions in BC and by other community groups across Canada. Our chronic pain work in Kootenay Boundary included developing a directory of services for Nelson and Trail, support for the Rise Above Pain not-for-profit project in Nelson, the building of a chronic pain action team in Trail, and the launch of a pilot project to introduce a chronic pain advisor. Physicians can refer patients to the CPA, who will connect them with community and other supports and help them improve their self-management capacity. For telehealth, video conferencing services have been extended to include 6 specialty departments, including general surgery, anesthesiology, urology, internal medicine, pediatrics, and obstetrics. And the MBMD secure messaging system was launched with 74% of KB physicians setting up their accounts and over 13,000 uses since January 2017. The proof of concept in Boundary is in full swing with 3 of 4 new staff hired and services at Boundary Hospital reconfigured to relieve pressure on the emergency department. Already this work is potentially seeing results with a 7.6% decrease in CTAS 4-5 ED visits and 8.2% decrease in scheduled ED visits over the same period last year. In the medical education realm, KB Division members supported the Selkirk Rural Pre-Medicine Program. The division set a fundraising target and members responded, exceeding it by almost $1,000. The funds supported 7 students with scholarships in 2017. And it's not just the students who are learning. Check out this one-pager to see some results of the KB CPD program. More and more GPs are using Pathways for its extensive physician and patient resources and specialist referral network. In fact, over 48% of KB GPs have accessed Pathways in the last month, and the Fetch Community Resources website is also seeing success with over 15,000 unique visitors since launch. Practice supports have included EMR optimization and integration work with multiple clinics, a PSP small group learning series, as well as individual one-on-one coaching with 8 GPs through 2016-17. We launched an EMR forms optimization project which brought over 60 auto-populating forms to KB clinics using IntraHealth Profile. This work has been adopted by the Provincial Pathways team to disseminate forms to profile clinics across BC. And as part of the proof of concept, we worked with all Boundary clinics to integrate their EMR systems, creating a single electronic medical record for each patient, accessible by all clinics and EDs. And finally, physician recruitment work with division members and local and provincial bodies has supported the recruitment of 7 new GPs to KB this year and 12 locums referred to KB clinics. All this information and more can be found in our bite-sized annual report, 2 pages chock full of heady goodness. And of course, with the report you'll find a link to our website where even more detail awaits you. Thanks for watching.